Whenever a patient gets a breast augmentation or any surgery with implants, they need to realize that it's not just one surgery, that they're going to be coming back for maintenance surgery. And they say about every 10 years, per the manufacturer, basically a shell can form a hole in it or a rupture within a 10-year period of time, and there's a warranty for that. And it's usually from friction and from wear and tear. If there's a rupture, it can be hard to detect with silicone because the gel doesn't easily leak out of this bag. And so an MRI would be the best way to check the shell because there can be no visible evidence of rupture. I would say the biggest reason people come back for redos is just for cosmetic desires because their breasts look different as time passes, which is normal because many women will potentially weight fluctuate. Some women have more children. Some people hormonally fluctuate and their breasts simply look different. And that can be a big reason to have breasts redone. But there's no mandatory surgery. So it's not like you're going to come back every 10 years for absolutely no reason. There has to be a reason, whether it's a cosmetic desire to look a certain way or a rupture, and that would be an indication to have surgery, but not just for no reason.